everyone. Welcome to Global Education Therapy's webinar series. Today, we are partnering with Therapy Solutions, one of our new sponsors, to talk about a parent's guide to psych ed evaluations. So today, we have the lovely Dr. Amy Holston today. How are you today?
Good. How are you doing this morning?
Doing great. So Dr. Amy is going to really just kind of go over your questions, just kind of lots of thoughts that we have as parents, especially abroad, about psych ed testing, because it's this huge thing that's overwhelming. So what we're going to do is try to condense it and make it easy to follow. Okay. All right.
Yep.
Yes. All right. So what we're going to do first is just kind of go over, mini slides, our sponsors affiliation. So as you know, we're partnered with lots of great services. So besides Therapy Solutions, we're also with educational consulting for international schools. We're with counseling. We also work with online schools and behavior and lots of expat transitional services. So if you're interested, go ahead and check them out in our website. Okay. All right. So what are we covering today? So we're going to go over who we are. We're going to go over what exactly a psych ed evaluation is, how it can help, how is it done online? I think that's the big question a lot of our parents have, just because it's such an obscure, strange world we live in now. So Dr. Amy's going to help us out with that. Of course, logistics, and lastly, your questions that you sent to us. Thank you about this topic. All right, so let's get started. So who are we? So as you know, I'm Christine. I'm an occupational therapist at GET. GET is one of the winners of the GHB Most Inclusive Services for Speech and Occupational Therapy. And so, yay, we are enjoying that as if, because not only do we provide services around the world, but we actually have discounted services for families that cannot afford a typical quality service. So we have group services, we have special discounts and things. So feel free to go on our website about that. A little bit about me. I have a master's in occupational therapy at the University of Southern California. My specialties are specifically in sensory, feeding, self-regulation, and fine motor skills, but I pretty much dabble in everything, jack of all trades and stuff like that. I am also an expat as well as an expat parent, and I'm also a third culture kid as well. So all those lovely little dimensions of living abroad, I have a little bit of experience. And a little bit more about me. I love cooking, I love traveling, and I think lately finger painting with my toddler, although sometimes I regret that because my house is not as tidy as I would like it to be. But I'm sure Dr. Amy, you understand that, right?
Absolutely, yeah.
All right. So, Dr. Amy, tell me more about you.
All right. So my name is Amy Holston. I work at Therapy Solutions. I actually recently just started there. It's a fantastic practice where they serve American expats who live overseas, but also who repatriated back to the United States to focus on meeting mental health needs for adults, children, and families. They do couples work as well, and assessment. It's an entirely telehealth practice, which I'm super excited about. I got really excited about telehealth during COVID. We were sort of forced into it where I was. We had to, within a week, flip our practice from all in person to telehealth. And we honestly never went back. It just opened services up to so many people we couldn't see before. So it's been fantastic. So Therapy Solutions is a great place to be. I have a PhD in clinical psych and, of course, a master's degree in clinical psych. Been a psychologist for 30 years. I don't want to age myself too much, but a long time. And have specialized in children assessment and trauma and developmental disorders, probably for the majority of that training, and have done private practice work for about 20 years. Obviously worked in state hospitals, and I was a college professor for a while, et cetera. But most of my work has been in private practice. So I really enjoy sitting down with families and getting to know them and their needs and be able to match that in a one-on-one space. It's just a little bit better of an institutionalized setting. I have 5 kids. They range from 30s to 14. My twins are 14. I have twins. One of our children, who's 19, is special needs, intellectual disability and autism spectrum. And so that's been a really fun journey for us. It didn't start out that way, but it has been that way, and really fueled my passion for assessment, and assessment of children who have needs and a focus on strengths. Not knowing that there aren't needs that kids have, but a real focus on their strengths. I love the water, the beach, the lake, anywhere. I hope to retire there one day, somewhere where there is water. Mountains in the background would be nice, but I'll settle just for water. I love to read. I read voraciously everything, fiction, nonfiction, self-help, psych, whatever. I love reading. And I love to travel. Whenever time presents itself for our family, we're kind of busy. My husband and I with the kiddos, but when we can, we love to travel all over. And I have a new grandchild, so I love to spend time with him too. Super fun. He just turned a year old, so that's been a real joy.
Oh, well,
Yeah.
congrats on the year old. That's a big
Yeah,
one.
yeah.
And thank you
It's been pretty
sharing
fun.
so much about your kids and your journey. I think that really means a lot to us. So thank you, Dr.
Yeah.
Amy.
Yeah.
All right.
All right, so we'll start out. I'm just going to talk about, what is a psychological educational evaluation. We call them psych eds for short, but what we're really talking about, it's an evaluation. It's comprehensive. It assesses strengths in learning. It also assesses our weaknesses as well, but we really try and focus on strengths in order to build a learning plan that supports a child. You can identify those weaknesses, but we have to have those strengths as well. But what a lot of people don't realize about a psycho ed is we're also looking at a child's emotional needs. So it's not just learning needs, intellectual ability, it's their emotional needs. We know that emotional needs or mental health diagnoses impact learning in the classroom. It's not just your IQ. So we're looking at, of course, an intellectual functioning, academic functioning. We measure both of those very objectively, like with numbers. Sometimes parents like the numbers and sometimes they don't. We try and explain those in a way that makes sense when we're finished. But we also really do look at those social and emotional needs. How do they interact with other kids? How do they interact with adults? Anxiety, etc. These things really impact learning. We're not just looking at how smart a kid is. That's really a parent's first question, meaning of feedback. What's their IQ, Dr. Holston? I'm like, well, I'm going to tell you their IQ, but that's one piece of the puzzle, and it doesn't quite always mean what you think it does. The goal really is to get a big picture, an overview picture of a child, and all the factors that impact learning and achievement. Even kids whose IQ are average or above average don't always succeed, and we have lots of examples of that, and that's just because we know there's a lot more to it. Our academic focus in a psych ed is we really look. Again, objectively, we're looking at numbers related to reading, writing, and math, and we are interested in mental health and emotional needs, but we know that the performance is what most parents want. How can I help my kiddo? How can I get him through the next grade? How can I take away the stress of those grades that are assigned? How can we use evidence-based data to support their learning, especially in reading? We have so much great data now. If we can identify the reading issue, we have a lot of great research-based, evidence-based data that supports children in learning how to read. So we do want those numbers, and we focused on those big three. All the subjects are important, but we know that they're based in your ability to read, write, and do basic math. A test, when you come in, there's a lot of things involved. It's not just you bring your child to an appointment and you sit them down on a desk and they take tests like in a school classroom, which is actually what most children think they're going to do. We'll talk about that later, how to prepare your child, because it's not that. And many children are they're scared of the process, etc. But we do a lot of things during testing. Some of it's even fun. I'm a psychologist, so I'm a little biased about what's fun or not, but to me, it's kind of fun. We do a lot of clinical interviewing. We definitely start out with the clinical interview of the parents. Other important figures. I love to talk to teachers if they're available. They have just a wealth of information for us. There are certainly written tests. Your children will write things down. We need a sample of that writing. We need a sample of their ability to transcribe what they hear onto paper. We need that for sure. Lots of performance measures where your children are putting together sequences of blocks, they're putting together puzzles, they're looking for things that are missing, they're tapping a button on the computer for auditory attention or visual attention. We're measuring those based on performance tests. So kids actually do lots of things in the room with us, but we also look at historical data. Very interested. It's not just a snapshot of your child in this moment. right? We need the historical picture of your child. That's critically important. Was learning to read difficult for them, or did they seem to pick it up quite easily and then they hit third grade and they just stopped? It became a struggle. That's pretty critical information to help us pinpoint where the issue is. Has something happened in your life, that coincides with the difficulty in school? So we're really not getting one snapshot of a few hours of your child and trying to make these big decisions about them. We're trying really hard to get a more global picture of who your child is. So all these things are comprised in a psych ed evaluation.
Definitely. It sounds really comprehensive, which I think is a
Yes,
really big key word about these evaluations. So I know you said something about logistics. So if you can go over those, I think that would be great.
Absolutely. And this part to me is really important because people come into a psych ed evaluation and they don't know what to expect. They don't know how to prepare their children. Parents are nervous too, right? Because, a lot of parents tell me things like, I want you to know that we're a good parent, or we have books at home, or we've read to them since they were a baby. Like, of course you have. I believe that you've done all these things. But it helps to know what we're looking for and what happens. It just helps to alleviate that anxiety. So I like to sort of lift the veil off that for people a little bit. When a child is referred, and they can be referred by a teacher, their pediatrician, another developmental specialist that they work with, like an OT or PT or speech therapist, or parents. A lot of parents self-refer. A lot of parents have been at the school, questioning, something's wrong with my child. It doesn't feel right. Something's not going well. And the school's like, no, they're great. They're doing great. They're passing. And sometimes a parent their gut says, something's not right here. I know they're doing okay in school, but I feel it. So parents can self-refer as well. And I had a lot of parents tell me before that they didn't know they could self-refer. They could just call up and say, hey, can you help me take a look at my kiddo? And you can do that. You don't need a professional to send a child to decide that there's a problem. A parent has the ability to do that. A lot of times it does come from professionals or other professionals in a child's life give that prod, but a parent can do that as well. So what happens after the referral comes is initially the psychologist will meet with the adults. We want to meet with the grownups. We're going to meet your kiddo too, but we want to meet with the grownups first. We need, as part of that comprehensive picture of a child, we need the relevant historical and developmental data. So we're going to go back and ask things about your pregnancy, childbirth, delivery, right at that postnatal period, health. We're going to ask about feeding patterns, sleeping patterns, all these things, tantrums, meltdowns, potty training, all those things that you don't think about to get a good developmental picture of your child. Going to try and also at that time get school and treatment records. Sometimes we get children who are in speech therapy, occupational therapy, et cetera. I want records from those therapists, if possible. Even better to call them on the phone and talk to them, have just a human conversation about a child. That's the best way to learn about them, right? You can hear it in someone's voice, things about a kiddo you can't always get on paper, but we try and get those records. Some kids have no treatment history, so we don't have that, but then we will try and talk to the school or daycare providers. Lots of our families have full-time nannies or grandparents that help do the full-time caregiving. I reach out to those people as well. They're pretty important because they spend a good bit of time, with that child every day. So that's where the process starts. We're gathering all the data. The whole time, your psychologist is trying to determine what test battery, what series of tests we're going to give your child. It's not the same for every kiddo. Parents always ask, what test are you going to do? And I can give a broad answer to that, but I don't really know until I have all the data about your child. I just don't know. There are lots of tests to choose from, and getting that background information is critical to making the right choices there. And we like for a child not to come to multiple sessions of testing because it can be a little stressful and intimidating. So we try and do it all at once. And so if you spend the time up front getting the historical information, then we can do that better. Then we're going to meet with the child, sometimes with the parents in the room and sometimes without. And again, it's hard to tell how this is going to go. Older children, usually it's a lot easier and better to meet with a kiddo without the parents. not because we're trying to hide anything or do secret things from parents at all, but kids really do respond quite differently when parents aren't in the room. My own kids too, right? They just respond differently when a parent's not in the room. A lot of my littles, I'll ask them basic questions like, tell me about school today, or what you have for lunch today. And they'll look at their mom first or their dad first before they answer, right? And they're not going to give me anything other than like chicken nuggets I had for lunch, but they just want to make sure, because there's this strange grown-up asking me these questions. And it's a little bit easier to build rapport with the kiddos sometimes if a parent's not in the room. For very young children, we almost always have the parents in the room. It just makes more sense that way. The children don't know us, they're frightened of us. And they're just going to do better with their comfort in the room. Teenagers, almost always without the parents. I personally always meet with all my kids with parents and child together. I've just sort of established that this is open communication. There are no secrets here. There's nothing that we can't talk about. But then with my older kids, usually 5 or 6 and up, depending on the developmental age of the child, I meet with the child by themselves too. What we're doing there is we're not reading your child's mind or judging your parenting, which is what some parents, I think we're doing. I'm really I'm assessing language. Asking questions in a certain way. You may not be able to tell, but I'll start with very open questions, move to closed questions. I'll use at different levels of adjectives and adverbs, etc., just to see how a child responds. I'll ask questions that require a pretty short answer that's pretty concise, and even a volley back to me, and see if they do that. And I ask some questions that require a more lengthy answer. And how does the child respond to that? I'm looking for their personality, anxiety, etc. That helps me know how to set up testing to be successful for your child. If they're a pretty anxious kiddo, I'm going to take that into account when we're doing testing. If they're flipping all over the furniture in 5 minutes, right, which is fine, but I'm going to need some activities during testing to keep your child engaged, right? So that's really what that intake session with the child's for. Then, as mentioned before, we're going to talk with those teachers, the care providers. We're also going to send them objective measures to fill out, where we formulate those numbers as well. I would love, in a perfect world, what a teacher tells me about a kiddo matches how they then rate the child. And that's what I'm trying to get there. The actual testing session, when you bring the child back for testing, lasts between 2 to 4 hours. Okay. It depends on the age of the child. It depends on what we're looking at. It depends on this is a reevaluation, a brand new evaluation. It depends on if we kind of think we know the diagnosis or, gosh, I can't figure out what's going on. That really determines the length of the battery. Children do some work on a computer, some work paper and pencil, some work with toys and blocks, puzzles. There are lots of manipulatives. We try really hard to keep it interesting and varied and as fun as we can so that they only have to come in for that one session. We don't have behavioral breakdowns. But I will say, I am not in the business anyway of stressing a kiddo out. If they're in tears on the floor under the table asking for mom, I'm going to get mom, right? I'm not trying to stress a kiddo out. I'm also not going to get great data. I'm not going to really get a sense of what I need to know if a child is stressed out. So those are the basic logistics of an evaluation.
All right. No, thank you. And I love that you gave us the preparation and like how intake looks, because very similar to OT, we look at things similarly, but you guys have such a wealth more to look at. So I think parents will really appreciate this information. Yeah. So I think the next question most of us are curious about, because once again, some parents self-refer, but some parents get the suggestion. So how does this type of testing help?
Yeah, and I think this is a great question, because some parents who are sent from another professional, they're kind of caught off guard. They're like, what? Something wrong with my kid? No, it's not. They're fantastic, or there's nothing wrong. And they're nervous. They're very nervous. And so I do try and spend a lot of time explaining how it can be helpful, because I really believe it is helpful. I think I would love to give all kids a psych ed and then have their whole educational plan based on it. That's just not reasonable. But there are ways which it's very helpful. Lots of benefits. So in some school systems, psychological testing is required. It's required by law to meet criteria both for gifted and special needs programs. You have to have a certain number. It's not just one number, but it's a combination of numbers that you do have to demonstrate your child qualifies for those services. And that's pretty important. If your child is gifted, they should be being served in a gifted curriculum to fully access and reach their potential for sure. If they're special needs, which some parents aren't excited about, they don't want their children to receive those services. But again, they're just not, it's meant to enhance a child, to get them to reach their fullest potential. And so a school system just cannot logistically provide the services without the data. And so one of the real benefits of a psych ed is the data. Just a practical benefit is to have that data for your child. It can also be a baseline for success. We can look at initial data and look at it again over a period of time to make sure our interventions are working. If we're doing these interventions and the numbers are not moving at all, particularly on achievement, then we're not doing something right. It doesn't mean that the intervention doesn't work. It probably does, but for your particular child and circumstance, it's not. We have lots of things we can pull out of our hat to try. I'm sure you know that in your field too. There's not just one way to approach a problem, right? But we're data driven, and we start with the thing that has the most data to support it. We move from there, but you can't know if it's working for your child if we haven't looked at it to see. Unfortunately, a parent's report about how something is going really isn't necessarily the best marker because we all want to see the best all the time in our kiddos. One of the ways, to me, and honestly, this is what happens the most and what I love the most about what I do. We oftentimes get children who are clearly struggling, either academically, with learning, social emotional factors that impact them in the classroom. But when we do the testing, they don't meet a criteria. Like they don't tick enough boxes to be diagnosed autistic or learning disabled or ADHD, but something is there. A psych eval really provides a tremendous amount of support for how to still help that child. Even when we can't give them that label that a school has to respond to by law, almost every school I've ever worked with still take this data and they use it to support a child. Like, okay, we don't have enough to hit the box, to check the thing, but we have all this data about how a child learns, their social emotional processes, how they interact with peers, their attention span, et cetera. And they still use that to help kids who are struggling. And parents can use it at home. If a school can't give you what you need, that doesn't mean you can't do it yourself. And you don't always need, anyway, there's lots of ways to approach that. It becomes a complicated topic, but you can do a lot of things at home to support your child if you know what the issues are. Again, identifying the strengths of a child to support learning is very important. If a kiddo is ADHD and they have trouble with auditory information, but their visual performance learning was off the charts, it was fantastic, we're going to get teachers to give them everything in a visual way. I haven't gotten rid of the ADHD then, of course, but I've taken a strength they have and I'm using it to help accommodate for what they struggle with, right? And that's a huge focus of an evaluation, especially with children. If we can identify their strengths, parents and educators can identify a learning plan for that kiddo that's going to help sit on top of the things they struggle with and pull it out as much as we possibly can. So that's critically important. And all kids have strengths. All kids have strengths. I've had parents sometimes tell me that they don't, but all kids do. We always find them and we can use them for learning. The other part, because I am a psychologist and therapist by training as well, the social emotional impact issues that impact children, it's important to me to highlight those. Parents are sometimes hesitant to get a diagnosis like generalized anxiety disorder, ADHD, PTSD for a child, and I understand that. I don't love labels myself for children for mental health. However, it's incredibly helpful for a teacher, a school system, or other professionals that work with your kiddo to know, hey, this kiddo's not just shy. They have a neurological response to stress. They're having a physiological reaction. This kiddo actually feels like they're going to throw up all day at school, right? They're terrified they're going to have a bathroom accident because they're so anxious. That's important information. And it's different than just being a little shy around your peers. If you have a child who has PTSD, I get this a fair amount because I do a lot of trauma assessment. Identifying that as PTSD and the triggers that impact the child, just critical. You can change a whole child's learning environment by just doing a lot to either reduce or eliminate those triggers for them in the school system. And you'd be pretty surprised how easy it is to do that. once they're identified. So this to me is really important. Many children, once we help control that social emotional piece for them, they just flourish, right? We give them skills to manage those triggers, skills to manage that feeling like you need to throw up at school, words for all of that. The grown-ups know and are supportive and don't think they're just being lazy or silly or whatever. It's quite helpful. We see kids flourish there. We also, probably the thing that we spend the most time on post-evaluation is a section called recommendations. And this is that specific interventions I'm talking about. We try really hard to put very specific research-based interventions for what your child's identified needs are. I always spend my feedback session asking a parent, I give them the written report because it's so much. And it's not signed. And I say, read that and come back to me. And you know, you're the expert on your kiddo. I'm not. I'm the expert on ADHD or dyslexia, but I'm not on your kiddo. So you go read this and tell me, okay, well, in my child's school with my kiddo, they really need this thing to happen. Absolutely. We can include that. And then we always write in there the child's IEP team, or whatever your school calls it, special education team, student support team. When they get together, they can use what we've written in recommendations and make it specific to their school and learning environment, what they can do. But it's a nice launch pad. It's a nice place to start, where we really begin to individualize it towards the child. And it's hard to do that without identifying what the specific needs and strengths are first. So that's really the meat of the report. Parents think it's all those numbers and how smart our child is, et cetera, or the diagnosis. But for us, it really is that recommendation piece. Okay, so now we have all this data. What do we do with it? How can I guide a school? How can I guide a daycare? How can I guide parents and grandparents to help this kiddo out? And so that's very valuable, I think. And sometimes it can take a week or two of parents and psychologists going back and forth with that. A parent sometimes will come back to me with something and it's just not reasonable. And I'm like, hey guys, so I hear you, but the school's probably not going to do that. And actually the research doesn't support it being helpful. But how about let's try this instead? You know, we just can have that banter back and forth, and it's quite helpful. And of course, evaluations are critical in identifying specific learning disabilities, which is dyslexia, dysgraphia, dyscalculia. We have very good targeted research-based methods of instruction for specific learning disabilities now. We didn't really have this 20 years ago, even 15 years ago. They've gotten so much better. And if we can identify where that area of learning disability is, most schools can come right in and just start doing their targeted reading intervention. And it's metrics based and they put numbers to it and we can see real success there. It might be slower than a parent wants it to be, but we still see success. And that is critically important. Children's difficulty with reading is not always due to a learning disability, but when it is, it's not easy, but it's a clear target for intervention with really good quality interventions to help. Yeah.
Definitely.
So that's how it's helpful.
Yeah, no, that is definitely helpful. And two things I would love to highlight. I would love to highlight. Thank you for mentioning the labels, because I think that's one of our families' things that a lot of people bring up. That's one of their anxieties. But I do love that you brought up that it's the best way for us, for the school, but also for professionals such as myself as an OT speech tutor, to know what type of intervention or what type of research-based method to help them with. You know, what is something like, okay, they're just shy, or okay, they're having a panic attack. So this is what we can do to help. So thank you for really focusing on that. And also thank you for all the psychologists for doing the accommodations and the suggestions. Those are helpful for us as well, because that's, of course, I go through the numbers, but I think that's the first page I look for. That way I'm like, okay, like this is the first track. This is the strategy. These are the tools I can implement. So thank you to Psych Ed for helping other professionals. We do appreciate it, but that is definitely a huge factor that can not just help other professionals, but professionals who work with your child down the line. Absolutely. So $1 million question for you, Dr. Amy. I think everybody, including myself, actually, have a little bit of question about this. How is this done online?
I know. It's a hot topic in my field too, right? I just listened to 2 podcasts about it this week where people are going back and forth. We have some emerging data. I'll be honest, online assessment is relatively new. COVID forced it for a lot of people. For a lot of psychologists, we literally, in the matter of 4 days, stopped doing assessment on children. But no one predicted how long the pandemic was going to take. So we get a few weeks in, a month in, and the backlog of children who need help. And we're like, we can't do this. This is not sustainable. We can't just not serve children, right? Because we can't be in a room with them. We can't do that. These children are not getting help. So people much smarter than me and much more creative than me began to figure out ways to do online assessment. These same people have also researched outcomes and efficacy and reliability, et cetera. That data is new. I think it's important. I heard in a podcast this week, actually, for someone who's leading the research in this area. She's like, absence of data doesn't mean there is no data to support it. It also doesn't mean it's a bad idea. The data we have coming out on online testing is that it seems to be the scores don't seem to be much different. The outcomes aren't different. We're not getting a lot of this is all technical. I'm not going to go into all of it, but it seems to be an equivalent experience. The issue that people are most concerned about, well, there's 2. One is technology, the failure of technology, and that's real. That is real. One study that was just published found surprisingly, the authors were surprised, relatively few, I think it was less than 5%. I can't remember because it's a brand new study, but relatively few errors or threats to validity of testing due to technological difficulties. Now, the caveat there is that's done because you prep a family well, you prep the site well, and you have a plan B and a plan C, right? So we know technology fails. We just have to figure out how to accommodate it when it happens. What can we do to fix it? What can we do instead? So the other big issue besides technology is that if you're not face-to-face, we're missing so much. This is also true. Like right now with us, you can't see my whole body. You can only see my face. You don't know if I have on pajama pants or a skirt or my leggings I'm going to go work out in later. You don't know what I'm doing with my feet down there. I could be missing a ton of physical anxiety cues because my leg is doing this. It's not, but it could be, right? So we're missing a lot of stuff. And people over time, not very young children, but certainly by mid-elementary school, humans are very good at regulating facial expressions. Our facial expression does not match our internal state of being very often, quite frankly. We learn, it's just a social thing that people learn. Even if you're very sad and you see grandma and she says, "How are you, little Johnny?" You say, "Great, grandma, I'm good." You don't say, "Oh, I'm so sad." You just don't do that with grandma because your mama told you not to. You learn it's not appropriate, right? So we just coach humans on the masking of expressions because it's not socially acceptable in most environments to share about all the time. So that's a real thing. There's also fatigue, meaning that there's something about an in-person human interaction that brings energy in the space. And when it's just you and a computer, fatigue can set in a lot faster. And again, we've just made accommodations for this. Now, the caveats to that are, we find that children and adolescents do very well with teleassessment. They're just used to the platform. It's a little bit harder for older adults. And I would argue, I think some people would probably say I was wrong, but I would argue really almost impossible for 4 and under. It's just, oh my gosh, it's hard. A 4-year-old, because it's hard. Okay. And there's not good data on 4-year-olds yet, but we do know for our older adult population, by older adult, I mean like 35 and older, not even really old, but the fatigue factor is a little bit more for them. For our elementary school age children, our pre-adolescents, adolescents, young adults, it's less of a factor. It's still there, but it's less of a factor. What online assessment requires is just planning, a lot of planning. Meticulously, you have to have plans in place. In a good telehealth assessment, your psychologist in your intake or your informed consent is going to go over and then give you a written plan for your plan A, plan B, plan C if technology fails, going to give you all your technological requirements. Like we know from the data now that headphones are quite helpful. Now, a child with developmental and sensory needs, this may not be possible. We need to talk that through. But outside of that, headphones are great. It filters out background noise. They can hear you much more clearly than just through the screen, because headphones are just so advanced now. It's amazing the sound quality, right? We know that that's helpful. We have several studies now that do it. So I always ask families to have them. Again, if it's a child who has a sensory issue, we just do some other things to filter out noise in the home, et cetera. We always have a backup plan for technology. It's not the same for every family. For some families, it's different. I have to really do a technological needs assessment of a family as part of the intake to see, what do you have access to? If our computer connection fails, what can we do? Can we reschedule? Can you get on? Do you have a tablet that you can use? Even a smartphone? What can we do? Sometimes this is not the optimal choice, but sometimes it's reschedule the appointment. And so you do prime a family for that. There's more flexibility required in an online assessment. I'm not in the room with the kiddo. So if there's a behavioral issue, I can't get in there. I'm pretty good at managing those, right? But because that's what I do for a living. Not everyone does that for a living. So when the child, throws the laptop across the room or whatever that they do, sometimes we have to stop because I don't have someone there with the child who can manage that behavior well and keep the testing going. If I'm in person and a kiddo wants to sit on the floor, I sit on the floor, right? I don't have a problem with that. We're on the floor. We're under the table. We're playing basketball, whatever it takes to get the assessment done. I've actually finished an assessment playing basketball before with a 12-year-old boy. He was better than me. Some parents are so anxious about the testing process and so anxious that their child be well behaved, they just can't do that for me. They can't be that flexible. That's okay. I don't need you to be who you aren't, but we have this discussion ahead of time and decide, right? It's just really planning for what's going to happen. There are certain technological needs that we want families to have, if at all possible. Size monitor, high-speed broadband, the headphones if we can have them, et cetera. One of the hardest issues with online assessment, and I'm speaking to children because children is my primary group, right, is the parents. I need them either to not be in the room, and they have a hard time with that, or if they're in the room, to not help a kiddo out. And it's hard. And I can give a parent that instruction like, hey, so I need you in the room for this, but I'm going to need you to sit behind and off to the side of the child. That's so I can see you, honestly. And even if they're struggling and they know the answer, you cannot jump in there and help them at all. And my parents are always like, absolutely, I understand. I will not do that. And I think it's just reflex, right? Where they just jump in and say, oh, you know how to do that. And that can invalidate the whole test, right? So I spent a lot of time prepping parents for this is just one picture of your kid. Remember, I'm getting a whole picture, not just a snapshot, right? How they respond to me and how they pull out data in a strange situation is just as important as how they can pull out data from their brain with you. But it's hard. The other issue is privacy and security. On our end, I know my computer is secure, my technology is encrypted, et cetera. I can't secure that for a parent, but I talk to them about how to do that, about how to have a private space for the child, free the room of clutter, shut the door, again, the headphones, et cetera. But we can only do what we can do. But overall, I find it to be a fantastic experience. I just love it. We can test so many more people. Kids really like it, honestly. They're so used to, they all take their technology to school. They do everything on their computers and laptops. It's no big deal for them. It's very familiar. It's really more parent fears that we have to address. And sometimes it requires an additional intake to accommodate that, to help a parent understand that it's okay. Yeah.
Definitely. Yeah. And I never knew how much prep was into this. I mean, I know we do a lot of prep too, but I love that you're really focusing on the technology, you got backups, and that the parents are instructed on how to do it. I will admit, and I think you would, you understand this too, Dr. Amy. as a professional, like, okay, this is the expectation, like blah, blah, blah.
Yeah.
But then when you're on the other side, when you're the parent,
Yes.
you have this fear of like, oh my gosh, they're judging me, they're judging my child,
Yes.
this. And I think that's what happens. You're just like, okay, let me
Yeah.
help, let me help. So I
Yeah.
definitely feel that. And I'm definitely
Yeah.
guilty
Yeah.
myself.
Yeah.
So
We
definitely,
all are, right? It's
we all
hard.
are. All right. So we're almost wrapping up, but we wanted to go ahead and answer your commonly asked questions. So for the first one, Dr. Amy, would you like to go ahead and ask that one, since I
Yes.
think both of us have a little bit of an answer for the first one?
Yeah, so I'm going to ask you primarily this. How do you find a provider who does online assessment while you're abroad? I know how to find them here in the States, but this is your area of expertise. So tell me how people do that.
Of course. So besides Therapy Solutions and our other partner, Dr. Mark Burdick, and you can go ahead and check them out in our sponsors part in the webpage. There's quite a lot of different ways to go. So I do actually recommend SENIA. That is the Special Education International Network Association. They not only is it for teachers and schools to learn how to practice inclusive practices, but it's actually for parents to find resources by other parents and professionals. So I highly recommend SENIA.
That's
I
great.
also really recommend logging into any of your expat or foreign service like social media actually, and asking your friends, and some groups actually have good insight on that. But overall, I highly do recommend finding associations that are international or focused on special education to really guide you in that direction. So once again, if you have more questions about that, you can check our website, and we actually have lots of recommendations for those associations.
That's great. Okay,
Yeah.
good.
Yeah, there's definitely more coming out these days. So
Yeah,
some more
resource for
questions.
me.
Yeah, I know. And I'm happy to send them your way too, Dr. Amy.
Yeah.
So yes. So the next one I think a lot of us have questions about is the cost. And I know that really varies on insurance and companies. So what would you say if a parent asked you this? What would you say for what is the cost for an assessment, and how much does insurance cover the cost?
Yeah. So this is a great question, and it's practical and real. Especially if you have a child with special needs, you have a lot of expenses. And so knowing how to plan for that's important. So the cost of the assessment varies greatly, but I would honestly say, I think for most children, an average assessment is going to run you between $1,800 and $2,800 American dollars, right? It's going to be about that. There are some children who require much more, and that expense will be more. We have to give a family a good faith estimate before we start testing to tell you how much it's going to cost. And that should happen. You should get that from any provider after your intake session. After they've met with you and gotten your history, and we have a better sense of the battery, you can do that. Almost all insurance covers psychological assessment for adults and children. The costs, of course, vary on your plan significantly. You'll meet your deductible, et cetera. But most plans, I don't know any plan that doesn't cover psychological assessment, or I've not run into it. Even if you have a provider who does not take insurance, which many providers don't for testing for a variety of reasons, you can still submit a bill to your insurance for reimbursement. It'll just be what they call out-of-network rates. And you can look that benefit up in whatever your benefit booklet is. But I would say that's the ballpark. It should not be a lot more than that. Now, I will give a caveat there. If this is any sort of court-related assessment where legal things are involved, if it's part of a divorce proceeding, et cetera, those costs become exponentially higher because the legal risk is higher. But for a standard traditional psychoed, that's a ballpark.
Okay, that's super helpful. Thank you.
Yeah.
I think you kind of already covered this. So if there's more to cover, let me know, or maybe something we missed. But are there other ways maybe you didn't bring up already about more ways to prepare my child for an online psych ed assessment? So for example, if your child's really nervous, like, can you talk to them? Can you prep them? Can you role play? Like, do you have any other suggestions like that?
So here's my main one, is that kids are so primed in school now for standardized tests. They get so nervous about them, right? And parents are so anxious about testing and what it's going to say about their children. All I really ask is that you just try and throw all that out and act like it's just going to be a fun day where we figure out how your brain works. That's it. We get to look at your brain, see how it works. It'll be so much fun. It's not like there's kids coming to me think they're getting shots. No shots, no x-ray machines. I'm not looking at your teeth, none of that. We're going to play games, do puzzles, and write some things down. And it's going to be fun. And we're going to see how our brain works. That's how I would love for you to prepare a child for an assessment. So we don't I don't mind doing it, but it's better not to spend 30 minutes promising them that we're not going to do anything painful or scary.
Yeah.
And there's no right or wrong answer, because there's not.
Definitely.
No right or wrong answer.
Yeah. I love that. That's such a good way of approaching it. Next question. And I think this is something a lot of people tell me, or at least about my reports too. This is a really long report. What are the most important things I should pay the most attention to reading the results? So I know you brought up accommodations, but is there anything else that parents should look at?
Yes. And I will say, as a field, we're working to make these reports shorter. But when I give a family report to read after our feedback session, I ask them to really focus on, number one, the accommodations. Look at them for your child. Does this work for your child? Are there things I've left out? But also, honestly, go back and look for, errors. Did I get your child's name right the whole time? I don't do it all the time. I did Holder and Holden. I wasn't even thinking, just in a report once, just simple things like that. And for most parents, there's a lot of technical jargon about standard scores and T-scores and Z-scores and you can, I don't want to say ignore it because it's important, but for most parents, just getting the one score, the summary that tells you the diagnosis, and make sure that sounds like your child. Again, you are the expert on your kiddo. And if it doesn't sound like your child, somebody has made a mistake somewhere, right? We need to talk about that. It's not the time to just accept the results like, yep, I hear you. Thank you so much. Even though it doesn't feel good in your gut. This is the time where you say, hey, gosh, how did you get there? It doesn't sound like the person I live with at all, right? So read it for that. Does it sound like your child, right? Does it give a voice to what you haven't been able to say before, right?
Yeah, I like that.
That's what you're kind of looking for. Yeah.
Definitely. So I think you've already covered this. And I think what's nice about you, Dr. Amy, is you've already kind of made a safe and open space for your clients. And I try to do the same. I hope I can, but I try to do the same. But some parents do ask, who can I talk to if I have questions about this report and the results? And I guess besides the psychologist, is there anybody else you recommend? Like, how would you answer this?
Yeah. So I hope it's your psychologist, right? But it's a space where you can go back and say, I don't understand this. This isn't my child. Explain this to me again. Almost any psychologist is going to answer those questions as many times as they need to, right? It's your child. And I think just trusting that a psychologist's goal is really just to support your child. It's not to judge the parent or do anything like that. It's just to support. If you run into a wall where you just can't be heard, go see a different clinician, and ask for a review of the data. I don't think that's the place to start because it's very hard to look at data you didn't get. I get this request a lot. I don't often do it actually. Because it's just an intimate process and I wasn't a part of it. So then to come afterwards and sort of give a judgment about it is difficult. But if you need to, absolutely don't sit with something that you're not happy with or you don't understand, don't. There really can be errors. We've all made them. And so if you feel like that there is one or there's a problem, keep coming back with it. The only thing your psychologist may not be willing to budge on is if you disagree with the diagnosis. This happens to me most often with autism. I'll either diagnose or not diagnose autism, and a parent will be very upset about that. And I always ask them, like I'm thinking of a family last week that I talked to, they were very, very upset. But I always invite them, like, help me see where this doesn't describe your child. Help me know where your problems are. I'm willing to acknowledge here that maybe I saw something that's not the norm for your family. Most parents, it can't do that. They just are very upset about the diagnosis. And I have to stand my ground. And then I'll just say, I know you don't want to hear it, but I really believe it's autism and these interventions are important. And if you come back to me in 4 years to tell me I was wrong, I will do cartwheels down the hall with you. Right. But right now, with what I have in this moment, this is what I'm telling you professionally is going on with your kiddo. So you may disagree with diagnosis, and always get a second opinion if you strongly disagree, but sometimes just it's hard information to hear.
Yeah.
Right.
Definitely,
It's hard.
definitely.
And yeah, but start with your psychologist for sure.
Yeah, definitely. And I'm going to second that. Like, definitely always any report, start with the person who
Yeah.
wrote it, because they're the
Yeah.
person who can give you the most information. They did the testing.
Yep.
I also have had those conversations as someone who does reports as well.
Yeah.
But I've also been on the other side where the parents like, hey, I tried to bring it up to a psychologist. And I don't think all psychologists are like this, but like they're just not helping me, or not, they don't
Right.
have the time to see me. Can you
Right.
review? And I always say like, hey, I didn't do the testing. This is
Yeah.
just my perspective. I normally just focus on the accommodations though, because I feel the most comfortable with that, and like probably like the writing and like some of the sensory assessments. But
Yeah.
the other things, I'm like, I really highly recommend talking to the person who did the testing if you can, and if you have a good rapport as well.
Yeah,
So
agreed.
that is excellent advice. So I think the last question, and I think that kind of actually ties into the last one, and I think this is every parent when they get the report, any report, right? I'm overwhelmed by this report. I disagree. I'm anxious, all these emotions, because it's a lot of emotions. It's hard to see your child in a different way, or maybe in a way that you agree with, but maybe, I don't want to say denial, but maybe something you haven't, really come to terms with. And diagnosis, what now? And that's so open-ended, but what would you say? Because I know people ask me that very often.
Yeah. And people ask me that too all the time. And I can see it in families' faces too, right? And I always tell parents, take this report, take it home, put it down, take a breath, just breathe. Nothing changed from yesterday. You have this report, your family is exactly the same. How you understand it might be different, but it's exactly the same. Mm-hmm. So take a breath. There are probably 2 pages of accommodations there. You do not need to do them all today. A report should last you for a couple of years. And so everything I think your child might need over that time period is in there to save you this stress again, right? So you don't need to do it all right now. Give it a few days. Take a breath. Do what you need to do. Call me back. We can start to prioritize or triage the list. Or better yet, like maybe the child's already in with OT or speech. Go sit down with your OT and ask them to triage this list with you. What do they think is the most important? This is their field. I defer to that expertise all the time. This is not what I do. I know your child needs this, but go ask them, right? See what they need. You don't need to do it all today. It is a lifelong journey. You don't need to do it all today. It's going to be fine.
Definitely. Yeah. Oh, those are wise words. Those are wise words. Yeah. And I love the idea that like just your family is the same, your understanding is different. And I think that's the big moment. So no, thank you. That was incredibly insightful. And Dr. Amy, thank you so much for your time.
Fun.
Yeah, this was really fun. This was really helpful for me just because I've never done the process online. I've been a part of the process, but never online. So this is super helpful just to see. But before we go, once again, this is from Global Education Therapy and Therapy Solutions. Any last words, Dr. Amy, before we sign off today?
No, I mean, I just think it's fun. I think psych testing is so helpful if you need it for your kids. Just don't be scared of it. It can help. The goal is to provide support and help. So
definitely. All right. Okay. Well, thank you so much for coming in today and explaining all of this and taking the time to answer our questions. Once again, if you guys have questions, feel free to reach out to Dr. Amy or us. We're always around, and we'll see you for the next webinar.